Hello, everyone. Welcome to the Tobacco Online Policy Seminar. Thank you for joining us today. I'm Caroline Wang, a PhD student at University of Minnesota School of Public Health. TOPS is by Mike Pascal at University of Xishan at the Ohio University, Mike and at Johns Hopkins University, Jamie Hartman Boyce at Massachusetts Amherst at Boston University. The seminar 1 hour with questions from the moderator and discussant. Audience may post questions and comments in the panel, and the moderator will draw from the comments in conversation center. Please review the guidelines tobaccopolicy.org questions. Please professional and related research being discussed. Questions our series guidelines will be shared. Your questions are very much appreciated. Long on the TOPS website.
Unfortunately, I think Caroline's audio is a little bit spotty, so apologize to everybody for that. I can take over. Today, we continue our winter 2026 season with a single paper presentation by Ataur Rahaman entitled The Impact of School Closure During COVID-19 on Substance Use. This presentation was selected by a competitive review process by submission through the TOPS website. Ataur Rahaman is a third-year PhD student in economics and a graduate research assistant at the University of Missouri. His research specializes in the economics of education with a particular focus on the impact of school leadership on teacher working conditions, retention, and school disciplinary climates. Dr. Mike Pesco, a professor at the University of Missouri, is a co-author of the study and will answer select questions in the Q&A. Ataur, thank you for presenting for us today. The floor is yours. You're muted, I think.
Thank you very much. Let me share my screen. Are you seeing me presenter mode?
We see your notes at the moment.
Okay, okay. Thank you. Thank you very much. Hi everyone. Thank you for attending. Thanks Top for the opportunity to present. My name is Ataur Rahaman. I am a PhD student at the University of Missouri, and this is a joint work with Michael Pesco, also at the University of Missouri. Today, I will present the delayed impact of school closure during COVID-19 on substance use. This is a work in progress. We welcome any feedback you have to improve the work. So a brief disclosure, this project is funded by the National Institute on Drug Abuse at the National Institutes of Health. The views presented here do not necessarily reflect those of the NIH. We have not received any tobacco-related funding. Here is the brief outline for today's talk. So let me say something very briefly about the COVID-19. So COVID-19 spread rapidly across the US in early 2020. By May, 48 states and DC had closed schools for the remainder of the academic year. Here is the brief highlight of the timeline. The first US cases emerged in late January. Temporary school closure began in mid-February. By early March, many schools shifted to distance learning. And one of the major things happened when the World Health Organization declared COVID-19 a pandemic. And from this point, many states starts to close their school. Ohio is the first state to announce a statewide closures. And by March 25th, almost all the public schools buildings were closed. And by May 6, nearly all states closed schools for the remaining of the academic year. But beginning in the next academic year, that means in 2021 academic year, starting in September 2020, the states and the local authority, they start a various method or an approach for the virtual learning. Among that, for example, 4 states left decision to schools or districts, which is like around 67% of the students nationwide. 13 states have a state-oriented, state-ordered in-person instructions. So like somehow they have to be open for a few days or some grades. Here is a figure from the data we have used from the author Parolin and the co-authors that illustrate the evaluation of school closures. We will describe this more in details in our data sections. As you can see that most of the closures occurred between March and May, which is like almost in the whole US. But from the beginning of August, we have a variation across the states that we can use to as a possible exogenous variations. Here is a high-level summary of the paper. So we want to study the delayed impact of school closures. That means that we have measured as a change in in-person visits on youth substance use. Our data is the foot traffic data from SafeGraph, and Earbase. Our identifying variations are coming from a state-level variation in school closure intensity. And the estimation strategy is a fixed effect model. And this is the primary result we have compared to students in states with no school closures. Those in states with average 2020 school closures intensity led to a 48.8 and 66 decrease in frequent and daily alcohol use in 2021 and 2023. A 19.3% and a 36.8% decrease in current and frequent marijuana use in 2021 and 2023. Now we begin with the literature on peer effect in this behavior. We know that schools are important social environments where peer influences shape behaviors. Adolescents tend to take more risk in the presence of peers, and this effect is substantially stronger for the teens than the adults. The neuroimaging evidence shows that peer amplify reward-related brain activity during risky decision making. Now we want to share some of the peer effect and substance use literature. First one is from a meta-analysis of 27 studies. They averaged over 99 effect sizes, and they found that peer influences is associated with adolescent substance use. Similarly, best friend substance use is more predictive for youth's own use than the family members. However, it is important to highlight that these studies are mostly correlations. However, we also have some causal studies that also find that peer effect can increase substance use and have a persistent effect. For example, especially notably Rovalino and Mercy, they found that it has a long-lasting effect of 7 to 14 years in the later life. Moving on, we also have a separate literature that shows that the adult students with adult and caring institutes can have a different effect. For example, supportive school connectedness help youth with lower substance use, and also family and school connectedness protect teens across major risk behavior. In summary, peer effects matters and have long-term impact. And on the other hand, supportive social connectedness improve the outcomes. That means lower risk of using substance. During the COVID-19, we have a disruption of negative peer effect channel and increased family monitoring. So we have a unique opportunity to exploit the variation in school closure intensity to find the evidence on the substance use. So in this study, we explored variation in school closure intensity measured as change in in-person visit as a possible exogenous to estimate delayed effect on youth substance use. Now we move on to data. Our primary data source is from Parolin, and they estimated the foot traffic of school locations from SafeGraph. SafeGraph uses global positioning systems data from around 10% of mobile devices, which is account for around 40 millions of people in the United States. This data is used to study the mobility pattern and foot traffic pattern to different businesses, such as schools and other public places. This comes from the opt-in location services within every smartphone apps, for example, weather apps or navigation apps or fitness apps. Whenever a user tells an app to allow location access, the app generates an enormous ping to provide its service. Then SafeGov aggregate these pings, and then it strips away all the names, cell phone numbers, and any other personal identifiers, and bundle them into the dataset to use for us. Although this is an opt-in in the app level, but most people may be unaware of the location data, but that has been aggregated and been used. This data is broadly representative of use demographic and geographics. SafeGraph sample of mobile devices closely correspond to the US Census population counts by state and also by county. And also a strong high correlation appears to exist between census counts and the estimated racial and ethical composition and educational group. To construct the foot traffic to school locations, the author uses some filters to figure out the students. For example, we can filter out the teachers because there are some days when only teachers actually work and no one go there, so we can filter out the teachers. Similarly, we can filter out the guardians because guardians usually go to the school during drop-off and pickups. Finally, the author manually check for the validity, whether their data corresponds to the school closures by checking few schools from each states from their school website about the variations in their school closures. In addition, they also check the data with Education Week's manually coded school closure status for more than 907 school districts. Just to let you know that as we said earlier, from the beginning of August, school had a variation in in-person visits. Some schools use a hybrid or partial scheme. Some schools use a fully remote schemes. So Education Weeks actually manually coded for percentage of schools that are in hybrid, percentage of schools that are in fully remote. And the author manually checked those schools for validity. Moving on, we use we get school level data from the author, and then we sum over within states for 2020 and 2029, and then we calculate the closure intensity. For example, if Missouri had 100 visits in 2019 and has 20 visits in 2020, then we can say that implied closure intensity is 80%, or there is 80% decline in-person visit. Secondly, our measures is a continuous measures that account for severity, not just a binary open and close. That means we know that school has a various school closure varied widely, as we had described earlier. Some schools provide remote learning, some schools allow some grade level to attend on certain days, and many others have different approaches. So our measures, continuous measures on severity, actually captured that. Finally, we rescale the intensity of closure by its mean. That means our 1 unit change, we can interpret a 1 unit increase as a correspond to a moving from a zero closure to sample mean level of closures. Here is a distribution of intensity of closure measures that we have calculated. As you can see from the first row, this is an unscaled one, which has a mean level closure of 0.35 or 35%, and a minimum of 0.18 and maximum of 0.53. And the bottom row, we showed the rescale version where the mean is rescaled to 1. Here is a graph of our intensity measures. The lighter shade shows the less change, lower number, and the darker shows the higher number. As you can see, there is a lot of variations across the states, and most of the states that are darker, that means as a high level of school closures, are in the coastal region. Our second source of data, that is our outcome data, comes from youth risk behavior surveillance system data from CDC. This data monitors youth risk behavior, for example, tobacco, alcohol, marijuana, and others. We use a state year-based, which is a biannual repeated cross-sections of high school students from grade 9 to 12. Typically, this survey waves starts in spring, except for 2021, when it happened in fall due to the COVID. And we as we will discuss later, this has a implication in our study. This survey is conducted by State Health or Education Department in collaboration with CDC, and then it has a representative of public high schools students within each state. And this survey is anonymous and self-administered survey, which takes around 60 minutes or 1 class period to finish. It has around 87 standard questions, and response rate dropped below 60% from 20. And we can see that overall response rate is around 35 to 70%. And the student response rate is 71 to 80%. The overall response rate actually dropped from 2015 onward. We use 4 outcome variables: cigarette, e-cigarette, alcohol, and marijuana. And from all of the 4, except marijuana, we have 3 measures of intensity based on how many days a student smoked or drank in last 30 days prior to the survey. We define current if a student says they use the substance at least 1 day, frequent if 20 days or more, and daily if they use all 30 days. The data set also has a student demographic, the age, race, sex, and the grade. Our panel covered 2011 to 2023, all odd years across 39 states. As it is, I want to mention that the year-based data does not contain all 50 states, because some of the states have not participated for many years because of they administered their own surveys or due to other reasons. Among these 39 states, our data panel is unbalanced because some of the states are missing in some waves, because some states did not permit the CDC to include their data in the combined data set, or the survey was not administered in that year in that state, or survey was conducted but response rate were too low to be included, or survey was conducted but the response rate falls below 60%, and non-response bias analysis indicated that data were not representative of the population. Here we have our descriptive statistics of the data. As you can see that it's like half of the students are female, and the grade level is distributed evenly, it's like 25% around, and most of the students are from 15 years to 18 years old. Then we have some control variables. First control variables are the taxes. We have cigarette, e-cigarette, and beer tax rate by state and year. And this tax rate is adjusted to CPI. Secondly, we have medical and recreational marijuana laws by state. Then we have state e-cigarette restrictions, flavor bans, and we also have a indicator variable for each level of minimum sales legal age of the e-cigarette by state. Moving on, we use a two-way fixed effect model, which includes both state and time fixed effect. The idea is to compare how outcome change within a state over time related to change in other states. We have a state fixed effect that control for all time invariant differences across states, for example, cultures or baseline policies. And we have time fixed effect that captures shocks that affect all states in a given year, for example, federal policies. The YIST is a binary substance use indicator that for student I in a state S and survey year T that we have, and we have already discussed about our Y variable earlier. The closure intensity in 2020 is the intensity of closure defined earlier. The X vector is a vector of student demographics. C is a vector of time-varying state level policies that we have discussed, that is taxes, medical and recreational marijuana laws, and e-cigarette restriction bans and flavors, and minimum legal sales age. And we have state and survey year fixed effect, and an arrow term that are clustered at the state level. So the beta is our parameter of interest that has a causal interpretation provided that parallel assumptions are met. And we need parallel assumptions to show so the causal interpretation rely on the parallel assumptions. That is, in the absence of the school closure, treated and less treated states would have followed the similar trend. If that holds, then the difference we observe can be attributed to the treatment. And all the regressions we have are survey weighted. And this beta is captured both short-run effect in 2021 and a long-run effect in 2023 from 2020 school closures. I will stop here to see if there are any questions you have.
Great, thanks so much. I would encourage audience members to put any questions that you have in the Q&A. Our discussant today is Dr. Sumedha Gupta, an associate professor of economics from Indiana University, Indianapolis. She studies health economics and applied microeconometrics with a focus on prescription drug policy, the economics of aging, and barriers in healthcare access across the life course. So Sumedha, any questions at this stage?
Yeah, first of all, thank you for having me here. This is such a great paper, so I'm excited to discuss it. I want to start by saying that, I'm personally interested in this topic. I have worked using SafeGraph data myself during the pandemic. And I have not looked at this very interesting outcome of understanding the long-term consequences of school closures on youth health behavior. So I was really fascinated by looking at these early stage results, and I'm very keen and looking forward to looking at the manuscript as and when it becomes available. I want to start by saying that these data really are valuable to look at, using SafeGraph foot traffic data to capture closure intensity, because the kind of granularity that offers is not easy to capture if you're just looking at these binaries of schools are closed versus open. So it kind of gives this dose response, which is invaluable. And so I think that's something that we should all be playing up as we get to writing these papers, right? I also then want to talk about separating, and I'm keen how you're going to address that when the results are presented, but I want to see what your thoughts are, because this is something that's come up in our work too, that how do you separate out, given the timing of this period, the effects of the closures from the broader COVID effect? And I think that's something that has troubled us a lot in our work. So I am very curious that how you all are thinking about tackling that and really disentangling that effect. For instance, is it just school closures, or is it that alcohol stores are shut down, right? Or tobacco stores are shut down. And so you can't really go and you buy. And I think part of that you could do is to lean into sort of the work that, including ours, which has shown that there was an increase in consumption by adults of alcohol, right? So at least it doesn't seem that there was. So that's something that I'm curious how you're thinking about disentangling that. Also, the delayed framing and the 2021 wave. So you frame these as sort of delayed effects, which I think is especially compelling for the 2023 data. But for the 2021 wave, I think the many states were still kind of, with school closures. And sometimes it was also voluntary, where parents were not sending their kids who were not vaccinated, yes, because this age group, pediatric vaccinations came somewhat later, and individuals was voluntarily not going to school and engaging in virtual learning, which in SafeGraph would show up as a closure, right? Because there's less foot traffic. So that's also something that it might be helpful if you could separate out the 2021 and the 2023 post periods, and maybe you'll talk more about that. So I'm kind of curious that how you will distinguish those contemporaneous from truly delayed effects. And then, of course, elementary versus high school, and your data is on high school. But yeah, I'll stop there, and I want to see what's to come.
Yeah. Any responses to those multiple questions?
Thank you very much. It's actually we have the same thought, but some of them we have a data constraint. For example, our year-based data is odd year. So it's like we can include only 2019 or 2021. Then if we add 2021 school closure, actually they have a differentiated school closure in 2021 also. Then you can add them up and average out. Then there is a possibility that school closure will be averaged out. For example, in some states they have a high level of school closure in 2020, but they have a very low level of school closure in 2021. Then if we average out, it will be we anticipated that it will be average out the high intensity during 2020. And for the others, we are still working on, and let's see if you have any more questions after the whole presentation.
Okay, maybe I'm not seeing any other audience questions, but maybe I would throw out one more, which I'm not very familiar with the SafeGraph, so maybe you can help me with this. But the state level school closure seems quite coarse when there is variation also at the local level or county level or school district level. And is it possible to disaggregate those data below the state level, especially because I think some of the mechanisms would be more local than sort of state in terms of how they get manifested?
Yes, the data we have actually in each school level. So we aggregated them to the state because the year-based data, we do not have we only have the state identifier. So we don't have in our outcome variable, we don't have school level identifier. So yeah, we actually requested the data from year-based. They said that they cannot give us below state level identifiers. So this is one of the restrictions we have, but otherwise we have a school level closure data from SafeGraph.
Okay, great. Thank you. Okay, so I'm not seeing any other questions at this point. So maybe feel free to proceed.
Yeah, thank you very much. So as we have said earlier that our causal interpretation depends on the parallel term assumptions. So in the upcoming slide, I am going to show a graph that we have divided our substance use, divided our school closure measures from below and medium substance use, and to show this is for only a illustration purpose. So as you can see, for example, on the left side, we have a current marine use that we have splitted our sample based on above and median school closure levels. Blue is above median level. As you can see that this the trend is following closely. but after the school closure in 2020, there is a huge drop in above median group, and then the gap actually seems to close after that. Just to note that this is a very a descriptive preview. This is not a causal one, and we actually have a formal test to check whether the pretend assumption hold or not. So this is a test for using a even study, and we can see that there is a suggestive evidence that the pretend assumption holds for the alcohol and marijuana. And also to note that the effect actually a delayed one, especially the effect is significant in 2023. Now we show the result for the alcohol. We have a separate graph now for the same event study we have we have seen earlier. As you can see, for the alcohol frequent and for the alcohol daily, the pretend seems to there is like evidence that parallel pretend holds, and we can see that the effect is a delayed one, especially in 2023. We have a result now. So because this is the first table and our tables are the similar, let me go through over the tables. So our first two columns are two different definition of the intensity of alcohol use. First one is the frequent one. Second two column is the daily one. And within each of these two columns, the second columns are where we have included the controls related to the first one. Then for each row, the first row is our parameter of interest. That is the intensity of closures in 2020 multiplied by the post. And then second row is where we have shown the cluster standard errors. Then we have a pre-mean of the dependent variables and the percentage of that pre-mean. That means our coefficient divided by the pre-mean, and we have number of observations. And if you want to look for the numbers, you can look only these four columns. So as we have mentioned earlier, that we rescale our intensity of closure measures to mean. That means 1 unit increase correspond to a moving from zero closure to sample mean closures. For example, our coefficient minus 0.006 on a frequent alcohol use implies that a 0.6 percentage point decline in probability of use. Given a 2019 mean of 0.012, this corresponds to a 50% reduction. This corresponds to a 42.8% reductions in related to pre-treatment mean. That means a student living in a state with the average 2020 school closure rate was 42.8% or 0.6 percentage point less likely to use alcohol frequently compared to a state that lived in a state without any alcohol closures, without any school closures. And the result is a bit higher for the daily use, which is 66.6%. And these are the delayed effect. That means the effect of short-run effect in 2021 plus a long-run effect in 2023. Similarly, this is the result for the marijuana. Is broadly the same. And for the case of marijuana, we can say that a student living in a state with the average 2020 school closure rate was 19.3% and 36.8% less likely to use marijuana currently and frequently, respectively, compared to a state that lived in students that lived in a state without any school closure. Now we want to show a possible mechanism. So the idea is that some students, particularly those in higher grades, may have already initiated substance use prior to school closures. For those students, we would expect a smaller effect because their behavior is likely to be more established. Motivated by this idea, we split the sample, that is our grade 9 to 12, into high and low exposure groups based on likely exposures to initiation opportunities. First group is high exposure group, those who are new to schools after 2020 closures. That means they are in junior high schoolers. Grade 9 and 10 in so this high exposure group includes grade 9 and 10 in 2021. That means in fall season. So our school closures is actually the whole year in 2020. So these fall groups is just in the next academic year. And then same cohort, that means the grade 9 and 10 in 2021 fall, they will be in grade 10 and 11 in 2023 because 2023 wave is in spring. So we anticipated that these two groups, they have low exposure to initiations, any kind of substance initiations because of the school closures during 2020. And then we have those group are high exposure. So then we have a low exposure groups. They are like older students. They already have initiated the substance use. These are grade 11 and 12 in 2021, and the same cohort, that means grade 11, that now in grade 12 in 2023. So based on this, we can now show the result of the initiation effect. First one is for the marijuana. As you can see, the result actually driven by high exposure group. That means high exposure to high exposure to school closures during COVID-19. And we can see that the low exposure groups, that means those who already initiated the cigarette substance use, their effect is not significant. We can see for the alcohol. For the alcohol, our estimate is very small. So even in the graphically, even we can see that, for example, in the alcohol daily, even we see that the low exposure group actually has the opposite result, but this size is actually very small. Finally, we have a robustness check where we leave out one states and re-estimate our whole model. And you can see from in the very left, the blue color, we have our baseline effect size, and then we drop each state from each of this bar. And you can see that even if we drop the states, the results effect sizes and the results are the similar. Same case hold for the marijuana use. So now we're going to show that we also have a result for cigarette and e-cigarette, but we dropped the result due to problematic pretent. As you can see, for the cigarette, we have the pretent is like you can see that it's a bit of problematic. But in the case of e-cigarette, the pretent seems to hold, but we don't have much of the data because the e-cigarette data starts in the year base from 2015. So we dropped those two results from our analysis. Let me conclude. So we use variation in intensity of school closures, possibly as a possible exogenous reduction in in-person school visit to estimate the delayed effect on youth substance use. We found that students who live in a state with the average 2020 school closure are experienced compared to the students who have no school closures, a decrease at 14.8% decrease and a 16.6% decrease in frequent and daily alcohol use in 2021 and 2023, a 19.3 and 36.8% decrease in current and frequent marijuana use in 2021 and 2023. These are the combined effect. This, especially the direction, is consistent with the social interaction and peer exposure literature, as we have mentioned earlier, that, for example, Powell and others, they found that the effect size of 10 to 20% per dollar increase in tax per pack. Our estimates 19 to 37% reduction in marijuana is bit high, and it's also bit higher in alcohol use. But they are not so directly comparable, we can say. But we want to say that this effect size is a bit high compared to other literature. First, we want to discuss some limitations. So first is about the measurement error, because like foot traffic data from the SAFE graphs, they may not like a representative of the school closures. For example, some students may not have their phones or like similarly anything like that. We argue that this is likely non-classical measurement errors because like mobile GPS foot traffics correlate with other school and community characteristics, and we don't know the direction of the bias. Second limitation is state level treatment. We do not have a school or district identifier in the year-based data, so we cannot use the variations, much of the variation we have in the safe graph data to tease out more about these effect sizes. These are the possible next steps. Maybe we can, because we have a problematic pretrend, especially in the cigarette and e-cigarette, we may think about pretrend adjustment. We may think about like heterogeneity, for example, by gender or by age groups, and we can further explore the potential mechanisms. Thank you very much for attending and having here. And I also want to extend my thanks to Social Impact Labs and other colleagues and students who give comments and suggestions during a first iteration of the presentations.
Great, thanks so much. That was a great presentation. I would again encourage everyone to put your questions in the Q&A if you have any, and I will first turn it back over to our discussant to see if Sumedha has any further comments or thoughts.
Thank you so much, Ataur and Justin. So this was a great presentation. Thank you. The results are really clean, especially for alcohol and marijuana, and the event studies for those look pretty solid. And the leave one out analysis is always reassuring for robustness. So thank you for already tackling that at an early stage of the project. Couple of things, and I'm sure this will not come as a surprise to you. The strikingly large effect sizes are something that I think you will be asked again and again to explain, right? A 43% reduction in frequent alcohol use or 67% reduction in daily alcohol use. Those are very large relative to what we have seen from other peer effects or tax policy literature. And I think it's particularly striking, maybe to me, because I have looked at the adult side of the effects of school closures on alcohol use, and we found a 2% increase in alcohol. It was statistically significant, but compared to the effect sizes that were presented here, it's helpful to kind of think about how do you reconcile this. And I think in some way, actually, it goes in your favor. And let me explain. I think if the mechanism was really the pandemic-induced stress, then you would have found also that even among youth, there would have been an increase in alcohol use. But what you're finding is that unlike the adult population, which may have experienced pandemic stress in a different way, in the adolescent or youth population, you're finding a reduction, and this opposite signed effect may imply the peer effect in this population relative to the adult population. So while the sign, I think, is something that you can use as a strength of your argument of peer effects, I think the magnitudes are still so large that it is something that might be, you'll have to kind of think hard about what might be driving this effect a little bit as well.
Maybe could we pause there and I'll see if there's any response to that point.
Thank you very much. This is actually something to think about. But in the alcohol, the size of if you see the mean, if we go back, the mean of the alcohol is very small. So pre-treatment is actually very, very small. So it's actually already, if you see the trend, the alcohol use among the youth already decreasing. So it's 50% of that already low mean. Actually, I don't know, maybe it's reasonable, we can say. And secondly, the previous literature found that the peer effect has a multiplier effect. So what we mean by that is that, for example, the teenagers who are in 9th grade and 10th grade, they didn't initiate this alcohol, for example, and they already know how to, like, for example, with the adult care or maybe staying with homes, and they already know how to behave maybe. So, and then when those kids go to the later grade, for example, in grade 11 and 12 in 2023, the school has now less use, the student now in the whole school use less substance compared to the, like, for example, previous years, right? So, and then this maybe lead to the newcomers use less because, like, maybe the overall school, the student now using less alcohol than before. Just an idea. I don't know.
So I think that's helpful. I don't know if the Justin, can I respond to?
Yes, please.
Oh, okay. So first, let me talk about the mean. I think one concern if your mean is so small is that if you're identifying this effect of just a handful of people, right? I think that's a concern because if there are just two people in the sample who are saying that and it becomes three, then it shows like a huge increase, right? So you might want to think a little bit about that, how many people are what these numbers, how many people are actually being counted in these numbers, I think, and whether you can really capture this effectively. And I think that's something that you should think about a little bit more. So that's one. The second thing I think I agree with your idea that there could be a multiplier effect of multiplier peer effect. I think that makes sense. But then my question would be that would you see that so quickly, right? Like, would you see that already in your 2021 and 2023 data? Or how long does that? And maybe there is literature out there that you can lean on a little bit and see that what has prior literature shown on how long does it take? Because you're talking about shifting cultural norms and we struggle with that, right? And now you're showing that this has this huge multiplier effect so quickly. And it would be great if that's actually the case, but I think I would encourage you to really see that what prior literature has found and whether this stands, strong and robust against some of those findings, or how you can reconcile the difference.
Thank you very much.
Any further thoughts, Sumita?
Yeah, one other thought that I had was that I was going to, by the way, one of my points was about the initiation. So I'm really glad that you did that in your updated slide deck. So I'm not going to go in that. That's great. But I will add by saying that I would like to see a little bit more sort of analyses to disentangle the persistence versus reversal, because the thing that jumped out to me was that your effects appears to grow from 21 to 2023, especially for marijuana. And in our earlier work, we found that after the schools reopened, there was a sort of reversal back to pre-pandemic levels. And I think part of it could just be, the stickiness of norms kind of argument that you're talking about. But I think, especially if it is connected to sort of initiation, if the people didn't get initiated in it, then you would find more longer term. But I think that is something that it would be really helpful to strengthen your work if you can really do deep analysis on that to establish that that's where it's coming from. So that was my second point that I wanted to mention. So thank you.
Any response to that question?
No, thank you. So we'll do that. So it's a very early work. So thank you very much for your suggestions, and we'll try to look into that.
Okay, we do have a few audience questions now. One is from Dan Romer. You introduced the study as motivated by peer effects on risk taking, but closing schools does not remove those effects. Closing schools is coincident with closing all kinds of in-person activity as well as access to stores. So not sure that is due to school closure any more than ability to meet in person outside of school. So thoughts on the fact that it's about school closures, pandemic disruptions, which I think Sumeda also pointed out. Any thoughts?
The idea that like whether it is like from a supply side one, because like students do not have the sources they usually had when the school were open. We argue that like we estimate we would see the reversal effect, right? So when the school were open, like, and we will see its reverse, but we didn't see in our data. That means it's mostly about peer effect. And in addition to that, we also measure is a delayed one. For example, our closer data is in 2020, but our first wave of year-based data in 2021. So that means it's not the case that students do not get the substances, because they could get in 2021 also. So we can say that it's more of a peer effect and like monitoring effect of by the adults, not the other way around.
Okay. Amanda Holmes asks, did you control in any way for other environmental factors that might relate to which schools were likelier to close? For example, were more affluent schools likelier to close, and could this impact the results?
We do not directly control that, but our closer intensity is a weighted one. So for example, if it is a larger schools, and also like especially the schools in the cities, tend to be larger and tend to be demographically different than the rural one. So our closer measure is a weighted one. So it's like potentially we are actually taking care of that.
Okay. Ian Irvine says or asks, have you any measures of psychological stress? The Ontario data indicates substantial increases in stress measures while simultaneously showing declines in consumption and alcohol, vapes, cannabis, etc. Negative effects. These are unconditional summary data. Do you have any psychological stress measures?
No, we do not have.
Okay, there's nothing in the survey that captures that.
We have to look at it. As far as I know, there is nothing.
Okay, great. So I'm not seeing others, so maybe I'll ask a couple of my own. So one is that you mentioned there's an unbalanced panel, and I wonder if that could in any way account for the differences in 2023 in particular. And I don't know if you've looked at if there are compositional differences that occur in the 2023 wave compared to other waves, for example, whether that could be driving any differential effects over time.
This is a very early stage. Thank you very much for your comment. We definitely will look into it, but we didn't look into it yet. But I can say that like we used the leave one out states. If you think that like 2023 there is like a different states, or some of the states are like leave out in 2023, or that like 2023 has a low response rate, I would say maybe you could say you would see a very fluctuated effect size due to the leave one out. But definitely we could go and check the balances and see whether 2023 or any of the missing state, or maybe like making the panel balanced, whether it makes the result a different one.
Yeah, it's a good point about the leave one out.
Yeah.
I think so. The other thing is about pre-trends for e-cigarettes. They didn't look that bad to me, but you sort of backed away from those results. Can you talk more about? I understand that this sort of the cigarette pre-trends were not good, but the e-cigarette ones looked decent to me. So thoughts on sort of like why you decided to de-emphasize those results?
So our e-cigarette result also shows a negative effect. So effect size is indirectional was negative. As far as I remember, some of them even significant, but I think we back out due to like low because like e-cigarette data start from 2015. But we are thinking about including those maybe in the main paper. We are still working on it, but somehow we decided not to include it in the presentation.
Okay. Sumeda just put a comment in the chat. Sumeda, do you want to come on back on camera and ask your question or raise the point?
Yeah, sure. Just smaller points. I was kind of wondering about any compositional changes in the survey, just given that it was the pandemic period. And you present this range of 35 to 70%, which is like really large, right? So did the pandemic differentially affect participation in high versus low closure states? Because that could create some sort of a compositional bias. I was just wondering if you had done some sort of, descriptive evaluation of that. Also, was just wondering about another measure of alcohol use, which is just current alcohol use. So you obviously presented results for daily use and frequent use, but not current alcohol use. And I was just wondering if there was a reason for that, or did I miss that? But if not, that could also be an interesting intensive margin story there. So just a couple of more thoughts, smaller thoughts.
So the compositional actually there is a drop in 2023. That's true, but there is a drop in overall response rate from 2015 actually. So from 2015 to 2017 and then 19 and 2021, 2023, and the response rate were below, I believe, 60 or 50%. So there is almost a steady decline of the overall response rate, but the student response rate is high, is still high. It's compared to other year is low. That's true, but it's still low from 2015 actually. It's not.
But is there relatively larger decline?
Yes, it's bit relatively larger decline in 2023. But the ERVs, the data provider, they actually have a compositional measures, like if the response rate is not how to say representative of the state, they actually do not include those states in the data. For example, in 2023, you'll see that some of the states are not reported because of the data is not weighted properly, that is like truly representative of the states. So you can see that like the ERVs people, they actually think about this compositional change due to the low response rate. I will definitely go and check specifically for 2023. Thank you for your suggestions.
And you might also consider, in addition to using survey weights, you could also consider using replicate weights to make sure that those results are consistent with what you're finding with the survey weights.
Thank you very much.
Okay, I think we are out of time, so we will turn it over to our MC. Thank you both for participation. Thanks for a great presentation.
All right, so we are out of time. Thank you to our presenter, moderator, and discussant. Finally, thank you to the audience of 94 people for your participation. Have a top-notch weekend.